Because one thing I've learned is this, in politics and in combat, cowardice is contagious, but so is courage. And if you're willing to be the first person over those ramparts, you will be shocked at how many people will come with you. I'm asking you to come with me. I'm asking you to be a part of the generation that will restore the promise of this country and breathe new life into it.
Hi, this is Nick Freitas, and welcome to Making the Argument. Today we're going to be talking about healthcare. Healthcare is obviously an incredibly important issue and one that politicians in the private sector have been addressing forever. Unfortunately, we see a lot of movement right now within the Democratic Party to move us toward a nationalized healthcare service. And to give you an idea what this is, it's essentially a government takeover of your healthcare. It would be a system where they essentially abolish private insurance, or they make it such a small portion of the actual healthcare system that you really don't see it much. Most of the money, most of the effort, most of the resources goes into the government actually having control over what your healthcare looks like. And we've seen this in a lot of places all over the world, everywhere from Venezuela to the UK, Canada, Cuba, etc. And the real question I have to ask is, okay, does it work very well? Do you see people in those countries overwhelmingly happy with their healthcare service, or do they end up leaving to go to other countries which operate under more free market principles? And I think one of the things that you see, especially in places like Cuba and Venezuela, is even though the government might mandate that you have healthcare, that doesn't mean you're going to actually have access to the doctors, nurses, hospitals, and specialists you need. But people will often say that, using Cuba and Venezuela as an example is not fair, that we should be using the National Health Service in the UK, or we should be using the healthcare system in Canada as our example. Well, again, what we see in those two areas is that when people really need healthcare and they need it quickly, they come to the United States. They don't stay within their government-run healthcare systems. And the reason for that is very simple. Despite what politicians might want to tell you, healthcare ultimately is about commodities and services, right? The commodities are things like the hospital, the MRI machine, scalpels, right? Services is the open heart surgery that you're receiving, right? So it's important to understand that when we look at healthcare, we have to recognize it for what it is, not what politicians might want to believe it is or tell you it is. Everyone knows that when you're sick, you want to be able to have access to quality, affordable healthcare in order to deal with whatever it is that you're struggling with at the time. And what we've seen in the UK from extreme conditions, such as two parents being told that they were not allowed to take their child to the United States to undergo procedures, even though it was completely paid for by the doctors and charity at the time. It was a British judge that said under their National Health Service laws, they were not permitted to take their child out of the country in order to get the care that they needed in order to try to save the child's life. That's reprehensible. The idea that a judge or that the government would tell you that you're not allowed to take your terminally ill child to someplace in order to try new and innovative procedures in order to try to save their life is just beyond reason to me. I can't imagine being told that I have to sit there and watch my child die because politicians had decided that all my options were up. You see similar things in Canada with respect to wait times. Wait times in Canada and the UK for healthcare, to include important healthcare, is significantly higher than it is here in the United States. And that's because the government micromanages, controls, and rations healthcare for people in those countries, leaving them very, very few options on the private sector in order to get the care they need. And this really plays out and with horrible results when we see things like delaying an MRI or delaying a scan or delaying some sort of medical procedure because in Canada or the UK you have to wait several months to get it. And the end result is that if you were getting a scan for a cancer screening or something like that, waiting 2 to 3 months to be able to begin the procedures to be able to fight that cancer is critical. And if you don't even know what you have, you could move into a different stage of cancer. And now all of a sudden, even if they give you the procedures, it's not going to have the same effect as it would in the United States when we can get you in there quicker and we can make sure that you get the medical care that you need in order to be able to survive, right? So it's important to understand government monopolization and control over healthcare does not produce better results. They can say all day long that everyone has coverage, but what we really want is care. It's not just coverage, it's care. Coverage without care is meaningless. Right? And unfortunately, that's what you see in these rationed systems and these government-controlled systems. But let's take a look at the American medical care system, because we all know that there's problems. Nobody suggests that we have a perfect system, and we all agree that there needs to be massive improvements going forward in order to ensure that everybody, again, has access to quality and affordable health care. Now, the left will tell you that the reason why we don't have better health care is because the government hasn't been involved enough. It was one of the big arguments for Obamacare in the first place. I want to tell you a little bit about how the federal government and state governments are specifically involved in micromanaging and controlling your health care. First of all, it's important to understand that there are over 600 federal regulations that hospitals, doctors, nurses, medical staff have to comply with, right? And if you look at these 600 regulations, this equates to massive amounts of time, effort, and money being spent not on providing you health care, but just complying. In fact, according to the American Hospital Association, it goes up to $39 billion a year. That means the average hospital of about 160 beds is spending $7.6 million a year just complying with federal regulations. That's the equivalent of over 50 full-time employees at each one of your hospitals, all right? Full-time hours that have to be dedicated just to compliance, right? That's not 59 positions that are able to provide you health care. That's not 59 positions focused on getting you the treatment that you need. No, that's just compliance with government paperwork, right? And did Obamacare actually fix this? Well, let's go back and look at what Obamacare promised to do. One of the biggest promises was if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. That turned out to be a lie, not a misstatement, not a misunderstanding. It was a flat out lie, because anyone could have told you that with this sort of government takeover of health insurance policy, that you were going to lose policies and that you were going to lose access to doctors that you needed. And we've seen that all over the country. The other thing that they promised was that it was going to lower premiums. Well, guess what? Premiums have doubled since 2013. So let's just call it for what it is. Obamacare failed to deliver on the promises it made to the American people and to those that desperately want health care. So the question is, what do we do going forward? How do we make it better? I think the first thing we have to acknowledge is that government interference has caused a lot of problems. The incredible amount of regulations, the taxes associated with it, all of this interference and micromanagement has actually provided fewer options into the marketplace. It's amazing how many smaller health insurance companies have gone away or been consolidated into larger ones. Most counties across the country don't offer more than one, maybe two health insurance plans for your family because of all the consolidation that took place as a result of Obamacare. And one of the reasons why these consolidations take place is because the government likes to pass mandates. Politicians love passing mandates because it puts them in a position where they're not raising taxes. They don't have to actually do the hard work of determining whether or not the resources are available in order to meet the mandate. They can just decree it to be so, and then the papers write glorious letters about them. In fact, I got attacked on this because there was an unfunded mandate in the General Assembly that said that you could not sell health insurance unless it covered autism up to a certain age. You need to understand, I have two cousins with autism. This is incredibly important to me. I've carried legislation to give families of special needs kids, to include parents of autism, more control over their education dollars so that they can get them the educational opportunities that they need. But when I did that, it was a funded mandate. When they were doing it, it was unfunded. They weren't adding additional resources. They weren't creating more doctors, more nurses, more specialists. They were just saying you have to do something. And the only way that that can be paid for is by increasing your premiums. So in their effort to help one sector of the population, they decided to hurt other people within the population and then wouldn't accept responsibility for what they were actually doing. I think that's wrong. We need to be transparent in the approach that we take in order to increase access for health care. So, what do we do? First of all, we need to understand that starting all the way back in the 1920s, the federal government has been interfering in order to restrict the supply of doctors, nurses, hospitals, etc. We saw it in the 20s and the 30s. We saw legislation that started to push a lot of your healthcare payments over to insurance, even healthcare that wouldn't typically fall within insurance. That caused prices to go up. It also tied it to your job, so that if you move jobs or you lose your job, now you end up being in a window or you actually lose coverage during that time. time. We saw more intervention in the 60s, and then of course Obamacare was one of the most significant government interventions into the economy. We also see this with prescription drugs, but we're going to have a separate podcast to address that because it is its own issue that we need to be able to get to the bottom of. So if we can start removing the regulations and taxes, what we can do is we can make it easier for people to actually engage in the health industry and the health marketplace. All right, I'll give you a perfect example of how this works. LASIK eye surgery 10 years ago would have cost you $2,500 per eye, and it was actually harder to find it. Today, it'll cost you less than $500 per eye. It's easier to find, and the quality is better. So why is it that within this one area, we see all of the things that we'd like to see across healthcare? Better access, better quality, and lower prices. It's because it's one of the least regulated portions of the healthcare industry. And you see this with other elective surgeries as well. When you make it easier to not only perform these surgeries, but to actually get access into the medical schools and the training that equip people to be able to provide these services, prices go down and quality goes up, right? It happens all across the board. We intuitively understand that this is how things work in the rest of the economy, whether you're buying a car or a smartphone or a TV or a laptop. But for some reason, politicians want to trick people into believing that the only way they can get access to healthcare is if they are controlling it. Well, who does that give power to? It doesn't give power to doctors. It doesn't give power to nurses. It sure as heck doesn't give power to patients, but it gives a lot of power to politicians. And politicians seem to crave power more than they do effective solutions for healthcare. Now, I've also taken heat on this idea that I don't support helping people with pre-existing conditions. And they've based that false attack on me exclusively on the idea that I don't think Obamacare has worked well for people. Well, again, if we look back at what healthcare is, it's doctors, it's nurses, it's procedures, right? Obamacare didn't create a single new doctor, a single new hospital, a single new nurse, a single new specialist. You know what it did create? Hundreds of new IRS agents. Because I know when I'm sick, I think to myself, gosh, I wish an IRS agent were here. Right? But that's what it did, because again, government doesn't always have the best ideas with respect to how to solve problems or overcome challenges. So yes, we do need to get rid of Obamacare because it's done more damage than good. Yes, some additional people got coverage, but the overall expense associated with that, combined with the actual drop in your accessibility to care, was problematic. We can do better. So we should get rid of Obamacare, but at the same time, we need to have that stopgap. We need to have that fail-safe for vulnerable communities and people with pre-existing conditions. And Republicans have offered up H.R. 962, which even says that Obamacare goes away, but we still keep in the protections for pre-existing conditions and for vulnerable populations, right? The next step, and this is critical, this is the one that nobody seems to want to talk about. We have to be able to increase the supply of medicine to meet the demand. If you don't increase the supply, you're either going to see rising prices, you're going to see less accessibility, or you're going to see rationing like we do in other government-run systems. But if we allow the supply to rise in order to meet the demand, we can continue to make sure that people have access not just to coverage, but to care, quality, affordable care. So how do we do that? Again, you got to remove the regulations. There are so many regulations in place right now which make it so difficult to be able to practice medicine on any level. There's a lot of scope of practices rules, which makes it incredibly difficult for people to be able to provide procedures or advice on things that they are really qualified to be able to do. You also see problems with respect to the expense of setting up medical schools in this country or other medical training centers, right? There was a few years back where as many students that were qualified to go to medical school, which means they had the grades, were turned away because we didn't have enough seats within our medical schools. That's insane. If we already know that we have a high demand for healthcare, then why aren't we seeing more medical schools pop up? Why aren't we seeing more opportunities for people that want to go into the health profession to be able to do so? And again, a large part of the answer to that is government regulations. So if we can start to remove those restrictions, if we can start to lower the taxes, if we can eliminate taxes when you are actually trying to save money in a health savings account, we can provide you the ability to not only have coverage, but have access to care that is not dependent upon where you work. And if COVID has taught us anything, it's that we shouldn't have health insurance exclusively tied to your job. The other thing that we need to do is understand that we do have people that are qualified to provide certain basic medical procedures. A lot of the things that we are using health insurance to pay for is not really something that health insurance was ever designed for. Health insurance is all about risk pools. It's all about things that you didn't anticipate happening, and so you have insurance to cover it so you don't go bankrupt when you need to get that critical procedure. But a lot of other things that we do within healthcare are really maintenance related. And here's an easy example. We all have car insurance for if we get in a massive accident that we can have our car done, or we can have somebody else that was involved, that their car can be fixed, that medical bills can be covered as a result. Like, that's the reason why we have car insurance. But we never dream of using car insurance to pay for our gas. Well, it's the same thing with things like routine checkups. It's the same thing with these sorts of procedures that are not critical or not necessarily tied to a catastrophic or a serious life-threatening injury, but something that we do is just part of our basic maintenance within our healthcare. We're starting to see more clinics pop up that will actually provide greater price transparency and far lower costs if you don't have to use an insurance company in order to go through the process of getting access to that care. And we should encourage more of that. We also need to be dealing with price transparency and eliminating surprise costs that we currently see within the health insurance industry. And that is a role that the legislature can play a critical part in. We actually passed good legislation on that in the Virginia General Assembly last year. I look forward to continuing to work on that process and that problem at the federal level as well. But to sum everything up, here's what we need to do if we're serious about quality, affordable healthcare, right? We need to get rid of Obamacare and other government restrictions that are standing in the way of you getting to the care that you actually need. We need to get the government out of this business of politicians promising you they're going to get coverage when that coverage doesn't actually provide the access to the care that you need. Secondly, put in the fail-safe for vulnerable populations and for people with pre-existing conditions. That way, as we're transforming and we're improving our healthcare industry, we don't leave the most vulnerable people behind. And then thirdly, remove the regulations that are actually standing in the way of the healthcare industry being able to expand its services and its personnel in order to make sure that we can have a more competitive environment in healthcare. And I guarantee you, just like in every other realm of the economy, quality will go up, prices will go down. And just like I mentioned with LASIK eye surgery, it's not as if we don't have a workable model within the healthcare industry already. There are a number of elective procedures where we see the positive benefits of allowing greater control in the hands of doctors and patients as opposed to bureaucrats and politicians. I hope this clears up where I stand on the healthcare issue. Obviously, this is a very complex issue. There are many, many facets to it. So if you do have any additional questions on where I might stand on a specific policy issue or where I might stand on a particular approach, we'd be happy to do that. But I wanted to make sure that you had a good overall understanding of where I come from, the problems that I see with the American healthcare system, why government has made it worse and is certainly not the answer for improving it, and how we can actually get to a level and get to a healthcare industry which provides quality, affordable, and accessible care to every American. Okay, now we're going to go over some questions we've had from our audience. So Elizabeth asked, would you advocate for keeping a ban on denial of health care due to a pre-existing condition? So back when I mentioned HR 962, that's actually exactly what that does. It says as we phase out Obamacare, we'll still provide coverage for the people that need it. But again, the long-term solution, and this is critical because any politician can promise you that they're going to force an insurance company to cover something regardless of your ability to pay. But ultimately, the only way that you're going to actually get that care is if we increase the supply of the actual specialists and procedures that are needed to cover that care. So it's important to understand that while we can maintain those restrictions in order to protect pre-existing conditions, we have to move to a system that actually increases the overall supply. If we don't do that, you will eventually overwhelm the healthcare coverage, and then you're going to end up with politicians promising you coverage without actually giving you access to care. Do you support being allowed to purchase healthcare plans across state lines? Absolutely. I think you should be able to buy your healthcare plan anywhere you want in the country. One of the reasons why we have so many restrictions on buying across state lines is because the government is so involved in determining what a healthcare plan can look like. So if you lose your health insurance plan because of some state law and now you want to purchase health insurance somewhere else, the government actually prevents you from doing so. It's one of the reasons why I vote against these unfunded mandates. When you make it illegal to sell a particular type of insurance, you are now telling customers they're no longer allowed to have that insurance, even if it's the one that works best for them or if it's the best one that they can afford. So I think it's really important to understand that these mandates at the state level prevent a lot of the buying health insurance coverage or access to doctors across state lines. The other thing that I've supported, and I've actually carried legislation for this, is to say that if you are a qualified doctor or nurse or medical professional anywhere in the United States, I think you should be able to practice in Virginia without having to go through a lot of additional hoops and red tape in order to do so. And what's interesting is the same Democrats that would not even allow that bill to be heard in special session actually rescinded or suspended a lot of the occupational licensing rules that we have that prevent qualified doctors from other states being able to provide services in Virginia. So if they understood that it was good policy during a pandemic, I don't understand why they don't understand why it would be good policy all the time. What plan would you support that would cover the most vulnerable in our society? So again, this goes back to we can have the stopgaps in place for the most vulnerable for pre-existing conditions, but there is no easy solution to this. If the government continues to artificially restrict supply while mandating coverage, you're just going to end up with worthless coverage. Right? We have to remove the regulations that makes it easier to be able to get into the medical profession, makes it easier for qualified people to get into the medical profession. Let me give you a perfect example of this. A Special Forces 18 Delta, right? That's a Special Forces medic. They go through extensive medical training, and then when they're in their job, they're constantly updating their training, and they're performing medical services in some of the most challenging environments in the world, like combat. So that Green Beret medic, when they're in the Philippines or Afghanistan or Iraq, they can deliver a baby, they can help with geriatric services, and oh, by the way, they can do trauma and fix a sucking chest wound under fire while returning fire and calling in a 9-line medevac and save your life. But when they get back to the United States, if they want to give your kids stitches, right, they can't do that unless they jump through a bunch of medical hoops. So we need to understand that, my gosh, for simple procedures, for simple checkups, why shouldn't we expand the environment for these qualified medics, Navy corpsmen, and things like that, and other people that want to be able to provide that sort of medical service are able to do so, able to hang a shingle and do so. There's no reason why we can't do that except for the fact that the government is once again artificially restricting supply. So the real plan moving forward is to make it easier for people to get the care they need by increasing the overall supply of hospitals, doctors, specialists, nurses, clinics, etc. The other big regulation that stands in the way is Certificate of Public Need. This is where if somebody wants to come in and actually provide medical services in an underserved community, not only do they have to ask permission from the government, they have to ask permission from their competition, right? Imagine, a Burger King wanting to move into your area and having to ask the permission of Wendy's and McDonald's before they do so, right? It's ridiculous. We need to remove those restrictions in order to make sure that underserved populations can also get access to the care that they need. How would you make healthcare accessible in a marketplace environment? Again, I think I explained that during the thing, but just to reiterate, the easier it is for people to engage in healthcare, the easier it is for people to become doctors, nurses, specialists, etc., the more people will be able to do it because there's a high demand. And when you increase that supply, again, prices go down, quality goes up. And the way we know this is true is not only because it works in every other sector of the economy, but we know it's true because it works in the portions of the healthcare industry where we've actually allowed it to take place. And then how can healthcare possibly be equal if we all have different income levels? So this is an interesting question, right? It's this idea that everyone's access to healthcare must be equal in order for it to be fair. Well, it's important to understand something. If that's what you want, then the only way that we're going to achieve it is if we bring down the quality of everyone's healthcare. The reason why we have far more quality procedures, far more quality pharmaceuticals, far more quality access to life-saving equipment is because we've allowed the healthcare industry to be able to develop things. We've allowed people to be able to invest in it. We've allowed people that needed care to be able to go and pay for it. So the whole goal here should be to allow the healthcare industry to expand and improve as much as possible within a marketplace environment. And what that does is it raises the level of care for everyone. Now, is a super wealthy person always going to be able to fly somewhere or get the medical care they need? Yeah, and the way we know that is because people in government-controlled systems get on a plane and fly to the United States in order to get care when they can't get it in their own systems. But what we also see in the United States healthcare system is an incredible amount of charity and generosity. We see people that can't necessarily afford to get a particular procedure, but being able to get it anyways because the doctor is willing to do it, because people were willing to fund it, because charities were willing to step in. And here's an interesting fact. If your local doctor wants to be able to give you care at a reduced rate, or they want to be able to give it to you for free because they know you and you're a friend, if they're taking Medicare or Medicaid, they can't do it. They cannot charge you prices underneath what the government has mandated unless they're doing some sort of, special charitable thing. That's not the way this should work. We should give doctors, we should give medical care professionals the ability to adjust their prices in order to help people within their community without having to worry about the red tape that they might potentially violate because of government control over our healthcare system. Another question here from Beverly. She says, Spanberger says Social Security and Medicaid will be cut because of POTUS executive order for a payroll tax holiday, causing trust funds to run out of money. Okay, so this kind of falls more into, we're actually going to address this on some other issues with Social Security and Medicaid, but since Medicaid's a part of it, I'll be happy to answer. Yeah, your payroll taxes go into Medicaid, it goes into Social Security. The president has actually suggested a payroll tax essentially holiday for citizens because obviously we're in a situation right now where it's hard enough for people to keep people employed and working and paying those taxes in the first place, and we don't want people to lose their jobs. The real problem here has been the draconian shutdowns of the economy in Democrat-controlled states, because Abigail Spanberger can complain all day long about about a payroll tax cut, but if everyone's losing their jobs because her favorite governor here in Virginia has shut down the economy, you're not going to get those taxes anyways. So the main thing that we need to do is make sure that we reopen our economy, get people back to work so that when we do look at these programs that people are dependent upon, we do have the resources in order to pay for it. And as I've said before, if Spanberger wants to be mad at someone, I got a perfect target for her party, because the Democratic Party moved Social Security from a protected fund into the general fund in the 1970s, and politicians, and especially Democrats, have been raiding it ever since in order to pay for the little programs. And the next thing you know, we have a crisis like this where we're not bringing in the same level of revenue, and because they turned Social Security into a pay-as-you-go system, we now have significant problems in that area, and so we have to move it back into a protected fund. And it's the same thing with Medicaid and everything else. They need to be protected funds, and you need to have a situation where you're allowing people to work, because if people can't work, as I've tried to explain to my Democrat colleagues, you can't tax what you don't allow them to earn. So Beverly, I hope that answers your question as well. Once again, thank you for joining us. Thank you very much for these questions. And again, if you do have questions, you can always go to nick4va.com onto our podcast section, look at the schedule. You can submit the questions you want for the particular issue that we're talking about that day. Again, we're going to do several more of these. I look forward to your questions, and I look forward to talking about these important issues and laying out what I really believe, so you don't have to hear it through the filter of negative attack ads coming from the Spanberger campaign. Once again, Nick Freitas with Making the Argument, and thank you very much.